Hello doctors, good evening. We'll go through the continuation topic of this emergency management. It will come in KC and in Shalya. In the previous lecture, we have discussed about the hyperpyrexia and these were the conditions which we'll go through in this emergency management. Acute hemorrhage, hyperpyrexia, hyperglycemia, hypoglycemia, hypertensive emergencies, acute abdominal pain, anuria, congestive heart failure, myocardial infarction, shock, syncope, status asthmaticus, drowning, etc. will come under this emergency management. As we already done with this hyperpyrexia, you can check in our playlist, KC playlist, or else I'll give it in the description. Next, in this session, we'll discuss about the hypoglycemia. Okay, what is hypoglycemia? What is the definition? Lower level of blood sugars in a person is considered as hypoglycemia. Hypo means low level, glycemia means sugar. Low level of sugar in an individual is considered as hypoglycemia. Next, what is the fasting blood sugar in normal? 70 to 110 mg per dl is the normal range of fasting blood sugar. 70 to 110 mg per dl. Usually, it is asked in the Viva examinations. What is the fasting blood sugar? At that time, we have to answer 70 to 110 mg per dl. Next, if it is less than 40 mg per dl, it is considered as hypoglycemia. If it is less than 40 mg per dl, it is considered as hypoglycemia. Next, what are the causes in a diabetic patient? Why hypoglycemia occurs is here. Pancreatic tumors. Any tumors in the pancreas results in hypoglycemia. Excessive consumption of alcohol without taking of food. Okay, excessive alcohol consumption with no food leads to hypoglycemia. Any liver diseases like liver cirrhosis, etc. will lead to hypoglycemia. Means abnormal functioning of liver is also a cause of hypoglycemia. Kidney failure leads to this hypoglycemia and hypothyroidism also lead to hypoglycemia. What are the causes? Pancreatic tumors, excessive alcohol without food intake, any liver diseases, kidney failure, hypothyroidism. Next, coming to signs and symptoms. What are they? Palpitation means hearing of his own heartbeat to outside. Headache, vomiting, tachycardia means increased heart rate, abdominal discomfort and sweating will be the signs and symptoms in this hypoglycemia. What are they? Palpitation, headache, vomiting, tachycardia, abdominal discomfort and sweating will be the signs and symptoms in this hypoglycemia. If less than 40 mg per dl, confusion and coma may be the conditions seen in an individual. Okay, if it is less than 40 mg per dl, confusion and coma will be seen, which is considered as the severity of hypoglycemia. Next, what are the investigations? Blood sugar level testing, fasting blood sugar, postpartum blood sugar and random blood sugar. All these were seen in this investigations. Whipple's triad will be examined here. Heavy exercise or after fasting, glucose level will decrease. After intake of glucose, symptoms will subside. These were the investigations will go through in this hypoglycemia. What are they? After heavy exercise or after fasting, glucose level will decrease and by intake of glucose, symptoms will subside. Next, what are the treatment principles? Here is 50 ml of 50% dextrose is administered to the patients. 50 ml of 50% dextrose is given and oral glucose 10 to 20 grams is administered to the individual who is afflicted with this hypoglycemia. What are the treatment procedures? Oral glucose administration of 10 to 20 grams and 50 ml of 50% dextrose is administered to an individual. This completes hypoglycemia. What is the definition? Decrease in the blood sugar level. What is the range of normal blood sugar? 70 to 110 mg per dl is the fasting blood sugar in normal. If it is less than 40 mg per dl, considered as hypoglycemia. What are the causes? Pancreatic tumors, abnormal functioning of the liver, excessive alcohol intake without food, kidney failure, and hypothyroidism were the causes for this hypoglycemia. Signs and symptoms were, in general, we can write palpitation, headache, tachycardia, sweating, abdominal discomfort, vomiting. In severity, if it is less than 40 mg per dl, confusion and coma will be the cases seen in this hypoglycemia. Whipple's triad is after heavy exercise or fasting, glucose level will decrease. After intake of glucose, symptoms will subside. This is considered as Whipple's triad. And while coming to the treatment, oral administration of glucose 10 to 20 grams and 50 ml of 50% dextrose is administered to the patient afflicted with this hypoglycemia. In the investigations, in further we can remember C-peptide test and serum insulin test were also done in the hypoglycemia. What are they? C-peptide and serum insulin test, examination of Whipple's triad, and fasting blood sugar level, random blood sugar level will be done in a patient afflicted with this hypoglycemia. Okay, thank you. Stay tuned to our channel for more and more concepts in an easy way. In next lectures, we will go through the fluid and acid-base balance, electrolyte balance. All this we will discuss in coming lectures. Thank you. Subscribe to our channel for more and more updates.